Hello everyone, I am Dr. Neha Gupta from Mediworld Fertility. Today we will talk about genetic disorders. क्या ये genetic disorders जो बच्चों में होते हैं, can we prevent these disorders happening in our children with the help of IVF? Yes. So IVF has a specialized form which is called as Pre-implantation Genetic Screening or Pre-implantation Genetic Testing for these disorders which can run in family. So monosomic disorders जैसे Thalassemia, Sickle cell anemia, which are pretty common, जिसमें हीमोग्लोबिनोपैथी है, आपका जो ब्लड है उसके सेल्स में ऑक्सीजन कैरिंग कैपेसिटी कम है. अगर ऐसा बच्चा थैलेसीमिया मेजर या सिकल सेल डिजीज के साथ पैदा होता है तो उनको मल्टीपल ब्लड ट्रांसफ्यूजन की ज़रूरत होती है और उनका लाइफ स्पैन भी बहुत अच्छा नहीं होता है. ऐसे केसेस में जहां हस्बैंड एंड वाइफ बोथ आर कैरियर्स फॉर दीज डिजीजेस, बी इट थैलेसीमिया और सिकल सेल एनीमिया or cystic fibrosis or these disorders which are running in their families, we can prevent these disorders from going to your progeny by doing genetic testing in the embryo before we transfer the embryo which is formed from your egg and your husband's sperm. So it is fairly simple. We do a normal cycle of IVF in which we give you injections for 10 days. We do the egg retrieval. We do ICSI, we culture your embryo till blastocyst, and that blastocyst, the day 5 embryo, is subjected to laser biopsy. That biopsy tissue we send to the genetic lab to find out that this baby is having this disorder or not. Before we proceed with this treatment, there is some pre-PGT workup that is needed, which is done through simple blood test. So we will take your and your husband's blood sample, or if you have any child who is suffering from the same disease, we can take his sample and identify the disorder and prepare the genetic lab before we go ahead and do an IVF. So if you have any genetic disorders which are running in the family or any anomalous babies who are born before this, then you can come and meet the IVF specialist. We can give you multiple options by which you can conceive with your own gametes, and we can screen the embryo and tell you that this baby is free of that genetic defect. So please do not be worried. If you have had any previous miscarriages or any previous bad history, children have passed away because of these diseases, we can help you to conceive a healthy baby by the help of IVF and pre-implantation genetic testing. I hope you like this video and it is informative to you. If you like it, please share it and share it with your friends and family. Whoever is having this kind of syndromes, we can rule out these syndromes before we transfer the embryo. Thank you so much.